So what are you doing for pediatric dentistry in your practice?
We do everything for pediatric dentistry. We start seeing children when they're 1 year old.
All right.
And at that appointment really is to just get them used to coming to the dentist. And a big part of that appointment, Randy, is to teach the parents how to take care of the child's mouth. So if they start coming young, then by the time they're ready to start having their teeth cleaned, they're really comfortable.
So if they're only 1 or 2 years old, why would you want to see them that earlier if they're still in their baby teeth?
Well, we want to get them used to coming, so they're not afraid. We give them a ride in the chair. We play with a little puppet. But we teach their parents how to take care of their mouths, which is really important. Yeah. And the kids love coming. You know, they got a prize and they do all that. A lot of parents
So you're set up then for kids in your practice?
Yeah.
Okay.
A lot of parents today think you have to take your kids to a pediatric dentist. It's really just not true. And we love to see the whole family. Part of the thing that we like to impress with pediatrics too is that they don't have to have fluoride in their diet and in their water or take fluoride pills to make their teeth strong. Really, the fluoride in your body is not good for your bones. So we don't condone that, but we do actually do topical fluoride when they come in to visit us.
Do you recommend like a non-fluoride toothpaste as well for children?
Yeah, and again, you know, as long as they're not swallowing it, it's not that big of a deal.
Yeah, because we have, look, we have medical doctors on the show from the American Academy of Anti-Aging Medicine or Functional Medicine, and they are bad-mouthing fluoride.
Yes.
But most of the dentists that come on my program, they're not up to speed, it seems like, on the dangers of fluoride.
Yeah. Again, when you ingest it, it's a big problem. Topically, not so much.
So if you're going to do fluoride, have a dentist do it.
Yes.
Not doing it at home through your toothpaste.
Correct.
Okay, good. And their teeth can still be good, so and you recommend toothpaste that don't have fluoride?
Yes.
And they're on the market, so there's lots of...
Oh yeah, options, many, many options.